Ontario has taken the first steps to reopening. COVID cases are on the decline across the province, and the vaccination campaign remains strong. As of last Friday, outdoor activities such as camping and eating at a restaurant patio were allowed. People could also do some shopping and attend a worship service indoors. Of course, all of those activities still governed by restrictions on numbers and other physical distancing protocols and health measures. To find out more about what this means for Northwestern Ontario, we've reached Dr. Janet DeMille, the medical officer for the Thunder Bay District Health Unit. Dr. DeMille, good morning.
Good morning, Amy.
Thanks for rejoining us today. Sorry our conversation got cut a bit short last week.
Well, hopefully the weather won't interfere with it this time.
No thunderstorms this morning, so that's
True.
a good sign. All right, so we are into reopening. As of yesterday, we had 35 active cases in the Thunder Bay District. What does that mean to you, that number?
It gives me a lot of reassurance. It gives me a lot of hope. I'm, generally optimistic, and I'm cautiously optimistic right now that we're really controlling COVID-19 in our area, both keeping the numbers low and, of course, with our immunization rate. And, at the same time, though, when I see what's happening just to the east of us in the Porcupine area, what they've experienced in the last month, there's a situation evolving in the Waterloo area. I know that there's still very much a risk, that we could have a cluster of cases or an outbreak that could be, fairly significant. So, still, encouraging people to be compliant with those measures and, just following those guidance and certainly getting vaccinated too.
Mm-hmm. And we have entered that first step of reopening. What were you watching for in the first days of that reopening?
So I really felt comfortable with the reopening and what was being reopened, and it was actually exciting to see, for example, the restaurant patios and people being able to gather there, or to be out. I'm really comfortable with those outdoor activities. Again, as long as people are following those public health measures, making sure you don't go if you have any symptoms, don't go out even to an outdoor patio, for example. But I felt really comfortable with what was being proposed for the reopening, or that what was reopened. And, I'm cautiously optimistic that we won't really see, any spread of the virus as a result of that. But, we're still encouraging people, if you have any symptoms, get tested. If you've been exposed, stay at home. Just follow those rules.
Mm-hmm. Speaking of what is able to open at this point, we know that many people working in personal services, like at hair salons, are very eager to reopen. Have you heard any discussion about whether that might be a possibility before the expected step 2?
So all of the reopening plan and the timelines of that is really coming from the provincial level, and it's being applied across the province. So as far as I can see, they're sticking to the plan that had been proposed, that is out, that roadmap to reopen, and there's that plan that there would be 21 days between the different steps, and really that's around the concern primarily of the Delta variant, and really wanting those case numbers in Ontario to really go down, and hospitals to recover from that latest surge that we experienced in Ontario. And that vaccination rate could go up. So I'm not aware of any particular changes that they're sort of proposing for that, but sometimes I don't get that advanced warning.
We did talk last week about your concern about that Delta variant, and you did say there have been very few cases of that here. Is there any change in that, or any update in terms of the number or a percentage of the cases we're seeing here that are that concerning variant?
So at this time, we're not aware of any Delta variant cases here. Hopefully we're not missing them. We do know that there are some to the east of us, like in the Timmins area from the Porcupine Health Unit, some down south, and some in other parts of the country. And in other parts of the world, of course. So we remain at risk, but certainly at this time, it's not here that we're aware of.
What makes you concerned that the cases could be missed when you say hopefully we're not missing them?
Well, what we know about is the people who get tested and where their test comes back positive. We might know about people who have been exposed, for example, exposed somewhere else that might be in our area. We would be aware of them and follow up with them. So, but if somebody has, let's say, traveled recently, they've come back here, if they start to have symptoms, we won't necessarily know that that's happening until that person gets tested. And so we're always, it feels like, the tests that we know about now, the positive tests, the person may have been symptomatic or exposed, a week or two ago. So it's always a little bit of a retrospective. So just encouraging people, if you have any symptoms, and check the our website to make sure you know what symptoms to watch out for. But it's really any symptoms, even if it's mild. Please get tested. If you think you've been exposed, if you have symptoms, get tested and isolate until that test result comes back, just so that it's not spreading. If you do happen to have COVID, because people are really caught off guard sometimes, they don't realize that they've been exposed and they have COVID, and it's really important to catch that early. And even we know, that the workplaces are doing those rapid testings as well, right? So, that's an important component of really that ongoing surveillance for COVID-19 in our area.
Do you worry that as people get their vaccines, if maybe they have a dose of a vaccine, that they might become a bit complacent, be less likely to go in for that test because they feel more secure?
I think that, that vaccination that could happen. And then it's also the summer time, and we did well last summer. And, there's overall lower numbers. So there's a low risk of being exposed really in our area right now. So that could lead to complacency. And, it's important that everybody stay informed about what's happening. If you're traveling, leaving our area, stay, inform yourself about what's going on in that other area with respect to COVID, so that you can take care of yourself, take care of the people that you're around, and certainly not risk bringing it back here. If you do, that you're taking the steps so that it doesn't spread here. I think, we've learned a lot in the last year. We know how to manage this virus, and I think people are responsive, and just encouraging people to maintain that level of vigilance, but reopen. Like, we can do what we're allowed to do, and I'm glad of that, but just maintain that level of vigilance.
You have mentioned some of the situations in other parts of the province, and we are seeing in particular in Saskatchewan right now the impact that this virus can have on children. What concerns has that situation brought to mind for you? That is just an example of the ongoing vulnerabilities we have, and even what the little cluster that we've had here in our area in the Thunder Bay District in the last few weeks, which is settling. This virus, can spread very quickly, and can seem to come out of the blue and spread very quickly and catch people off guard, and that can have impact. I mean, there are people in the hospital here, there are people in ICU here. It can, and this is something to still take seriously. And Saskatchewan is a really like a worst case example. It's also an example of where vaccines work, because one of the reasons why it's impacting children, more children than is because a lot of the adults actually have both their vaccines, and just with the rollout, the children, the youth didn't get it, so it's disproportionately impacting that group. So and COVID, it gets anybody. Even some, a newborn can get COVID, and certainly that's right up to 90-year-old getting COVID, and so we're still at risk, especially the Delta variant, but even the other variants of concern, spread more easily than the other COVID-19 viruses we've had here since the beginning of the pandemic, and we could see something like that happen here as well. I do want to spend the last few minutes talking about the vaccination campaign. So to the west of us, the Northwestern Health Unit has expanded second dose eligibility for anyone who had their first Pfizer or Moderna shot at least 28 days prior. Is that something that could be a possibility for the Thunder Bay Health Unit as well in the near future?
Yeah, absolutely. In fact, we might hear about it provincially, and we are sort of preparing for that opening up of eligibility, either to the next group or even a more broader opening up of eligibility, so people can come in and get their second doses. And of course, if you haven't gotten your first dose, there's absolutely opportunity to get that as well. What we're really focusing now, we very clearly have a lot of people interested in immunization. What we're focusing on now is really wanting to get people who are 70 years of age and older into the clinics, and especially here in Thunder Bay. We opened up some clinic space yesterday, even yesterday afternoon, opened up some spaces at the hospital's immunization clinic. That's at Lakehead University. They had some available spots, and opening it up especially for 70 years of age and older for second doses, because we know that that's a really key group. We want those people to have access to vaccine so they can become fully immunized. And we know that a lot of them have their first dose and are waiting for their second dose. There's a lot of people who have appointments for their second dose through, for example, our clinic in the next couple of weeks. So we're just looking for those other individuals who maybe had not had opportunity to get their second dose, and we're sort of giving them first dibs on the available appointments before it opens up more broadly.
All right, Dr. DeMille, we'll leave it there for today. But as always, I really appreciate your time. Thank you for being on the show.
Thank you very much, Amy.
Dr. Janet DeMille is the medical officer for the Thunder Bay District Health Unit.